Hello everyone, my name is Mitha Patel and today I'm going to be talking about the end-of-life care. More specifically, I will be discussing what end-of-life care is, what palliative care is and the benefits, and future steps you should take for yourself and your loved ones. We all know that death is inevitable, but when a loved one is affected by a terminal illness, it's not always easy to know how to react. In the final stages of an illness, it becomes clear that even the best care may not save our loved ones. So instead of focusing on curative measures, we shift the priority to making the patient comfortable. End-of-life care hopes to make death slightly more comfortable by providing the best quality of life until the end. This care helps patients with advanced incurable illnesses live in peace by managing their pain and symptoms. This can last weeks, months, or several years depending on the illness. The last stages of life are very challenging, so end-of-life caregivers, such as home health agents, nursing home personnel, hospice providers, and palliative care physicians, provide psychological, practical, spiritual, and grief support. Rather than dying in a hospital where you are constantly doing tests and procedures that will cost a fortune, we now have the option to receive care at home or a facility. Palliative care is a type of end-of-life care. Unlike medical care where you are treated as a patient, palliative care recognizes you as a person. This care is mostly for patients whose disease is unresponsive to treatment. However, it can also be used for anyone with a long-term disease that will in time probably cause their death. Palliative care improves the patient's quality of life by facing the problem associated with the disease through prevention and relief of suffering through early identification and assessment. They use interdisciplinary teams to provide comfort to their patients and offer counseling and support to families of the patient's treatment options and goals. Unlike hospice care, palliative care allows you to receive medical treatment and comfort care at the same time. Care can also begin any time during the disease. Studies have shown that early interventions of palliative care reduce direct costs, prevent depression, and help patients live longer. Palliative care shows positive effects on life, mood, and survival. Our society offers us a chance to die peacefully. They offer more patient-centered programs and give patients more autonomy on what services they want. What if something were to happen to you right now? Do you or a loved one know how you want your end-of-life care? No one knows when their time comes, so it's a good idea to spend time to plan out end-of-life decisions. While it may be uncomfortable and difficult, you have noticed that there are many options to choose from. Physicians urge individuals to talk with their families and healthcare providers about their care decisions. Figure out their goals of care, where they want to spend their last moments, and what treatments they want to receive. After making the decision, it is important to write it down. If an individual were unable to speak, physicians would know what to do. You have the right to die how you want, so it's important to have advanced care planning. Based on this video, my critical thinking question is, what are some ethical dilemmas that end-of-life care have faced?